Okay, so welcome to this short live podcast. And here we will be briefly talking about the new coronavirus, its prevention, and what we can do as a country, as a people, to defeat, not to defeat, but to prevent the 2019 novel coronavirus. It is very important as a people, as a country, to start implementing measures, start taking measures to totally stop the virus from entering our country. We just experienced the Ebola outbreak or the Ebola crisis in Liberia, and we all know what it did. With the broken health system we have as a country, the Ebola came and exposed how very weak our systems are. So for this threat, now it is known, it is worldwide, it is in most country right now. So what can we do as a country, as Liberia, with many challenges? What can we do to prevent this virus from entering our territory? What mechanisms we can put into place to protect our borders? So it is very, very important that we start to do something. We cannot wait the virus to enter Liberia, to enter our territory before coming up with measures, before coming up with a fight. So it is better we spend little right now to try all means possible to stop the coronavirus from entering Liberia. We don't have the capacity, we don't have the resources, we don't have the facility to fight. So it is important. There is a call to everyone, a call to us as a people, and a call to the government. But it is us, the people, we have the full responsibility to coordinate with each other, to support each other, to work with each other, to make sure that this virus does not enter Liberia. But given the case that our borders are very vulnerable, it is also important that we know what to do should the virus enter our country, because there are various means by which it has entered other countries. So we should be watchful right now as to what really we can do to avoid the virus entering Liberia. It is terrible where it is now in China. It is terrible how things have been going, how things going, like in Europe, in America, and part of Asia. The virus already there. There are also confirmed cases in all these areas. Over 11 countries already have confirmed cases. And there's also a reported case in Africa next door that is not confirmed, but suspected case is in Cote d'Ivoire. So it is not confirmed, but Cote d'Ivoire is next door. We share border with Cote d'Ivoire in Ivory Coast, in Neymar, in Grand Gide, and other places. So these areas are very vulnerable, and what we can do to stop this is very, 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 very cardinal. So firstly, let's talk about this whole issue about the coronavirus. How did it come to play, and where are we going as a people? Where are we now as a people? And what the global village is doing to curtail it, to stop it. That's what we need to do. We try by all means as a people to fight Ebola. We know what Ebola did. Ebola destroyed a lot of people. It did not come for, it did not segregate this person from this person. Ebola came to everybody. So be it your religious person or whoever, Ebola entered the lives, the home of everyone. So taking precaution right now as a country is very, very important. But let's look at the genesis of the Ebola virus. Not Ebola, but the coronavirus. In December 2019, there were clusters of pneumonia cases in China. At that time, investigation found that it was caused by previously unknown virus, and now they have come up with the name, the 2019 novel coronavirus. But let's quickly discuss what is currently known about this virus. Let's keep in mind that there is a new virus, and what is done about it now, or the perception about the virus now, might change in the future because it is actually new, and people are trying to study, scientists are trying to study from this point to this point to see how they can identify the specific strain and find exactly what treatment they can come up with. But coronavirus are a large group of viruses. They consist of a code of genetic materials that are surrounded by envelope with those protein spikes. So this gives the appearance of a crown. It actually gives the appearance of a crown when you actually look at the virus through the microscope. It actually gives it that shape of a crown. And a crown in Latin is called corona. So in Latin, crown is called corona. So that is how coronavirus got their name. So there are different types. Actually, there are different types of viruses that cause a number of human diseases, such as those respiratory and sometimes intestinal diseases, your stomach, your respiratory, organs, your throat and nose, and what you use to respire. So these are different areas or diseases or virus diseases occur. The respiratory disease can range from common cold to pneumonia, and in most people, the symptoms tend to be more like it's actually not acute, it's not severe in some people. However, there are types of coronaviruses that can cause severe diseases. So some causes, account for severe diseases. So these include severe acute respiratory syndrome, or the SARS virus. and this stuff occurred like in 2023. Like for example, the SARS virus, the SARS coronavirus in China in 2003, and the Middle East respiratory syndrome also, that is the MERS or COV, that was first identified in Saudi Arabia in 2012. So these are different strains of different types of the viruses. But the 2019 novel coronavirus was first identified in China. Remember, you heard in the news and wherever that, yeah, there's a serious outbreak in China. So, yes, the 2019 novel coronavirus was first identified here. Initially, it occurred in group of people with pneumonia who have been associated with seafood market in the city of Wuhan. So it actually started in Wuhan. There's a city in China, and it was actually associated with investigation shows that it was associated with that seafood market. The disease has since spread from those who were sick at that time to others, including family members and healthcare staffs. That we know whatever diseases or whatever outbreak, the most vulnerable people are our beloved men and women in the white. They are mostly vulnerable to whatever outbreak, whatever diseases, because some, they don't even know like what's going on with the person, and they're going to give care to that particular sick person, not knowing what exactly that virus, what exactly the sickness is, the history. And in most cases, many of the patients don't even give the exact history. What been happening to them, they will not tell you where they came from and stuff like that. They wouldn't know. So our health practitioners are mostly at risk when it comes to giving care, or when it comes to whatever outbreak that may occur at a particular time. But since then, there are hundreds of cases at present, as the disease has spread within China and all a number of countries, over 11 countries in America, in Europe, in Korea, in Japan, and other countries. They are also spread in many of those countries. So, where did the virus come from? It is also known that coronavirus or viruses circulate in a range of animals. Sometimes these viruses can make a jump from animals to human. It moves from human being to animal, but mostly investigation shows that the main reservoir for many of those viruses are animals. Animals are the main reservoir for those viruses. Sometimes these viruses can jump from animal to animal, man, human, and with that kind of intersection or transmission. So this is called a spillover, and could be due to a range of factors such as mutations in the virus or the increased contact between our interaction with those different animals. For example, the Middle East respiratory syndrome, or the MERS, COV, is known to be transmitted from camels. And then the SARS virus that took place in China in 2003, Also, it is believed that, or it is known that it also came from the civet cats. So there are different animals that can be the reservoir for those viruses. But for this 2019 novel coronavirus, it is still not yet known which specific animal is the reservoir. But the important thing about virus when it comes, we actually curious to know how it is transmitted. Because once we know the mode of transmission, yes, we can build a defense. We can build up different methods to prevent it once we know the medium through which they are transmitted. But the exact dynamics of how the virus is transmitted is yet to be determined. So they are still pondering, like, hey, why is it, like, how is this virus transmitted from, or how did the people currently affected or quarantined, how did it come in contact with this virus? And how is it spreading from this point to this point, from this country to this country? So these are major concerns, major things that scientists always like investigating to know. But in general, respiratory viruses are usually transmitted through droplets created when an infected person, somebody who is already infected with the virus, when they either cough or when they sneeze or chew something that has been contaminated with the virus. So because it is respiratory, somebody should be able to they cough and sneeze. So within that medium, so this actually, unlike the 2014 Ebola outbreak we have, even though it didn't start in 2014, but we experienced it in 2014. It was not an airborne virus. It was not an airborne disease. But for this, it is, because it travels, through the air, through coughing. Somebody that is around that is also not infected with this particular virus. When an infected person sneezes or cough and you are around, you are close to the person, you're also going to contract the virus. So it's very important. And the thing about it is that you wouldn't know like who is this person and who is that person. So in situation like this, we need to be careful. We need to be watchful to actually avoid contact with people showing different signs we're going to talk about. We need to avoid those people, or we need to be very, very, very careful with those people. And sometimes you might get contaminated, or you might get affected or infected also when you either touch somewhere or something that has already been contaminated by the virus. So not only coughing or not only sneezing from that infected person. So you can also touch anything that is already contaminated, that already has that virus. So it means our behavior practices, practices towards hygiene need to be changed right now. I mean, we need to go back to 2014 or early 2015 with those different hygienic practices. Those different practices we used to do: wash our hands, make sure we sanitize our hand with chlorine, with sanitizers and other things. Yes, we have to return to the time of Ebola. We need to bring back those practices. We need to bring back those memories of being very careful with how we handle things. But the interesting thing we also need to look at is, what are we doing as a people? Should we wait for the virus to enter Liberia before we start working on the prevention and other things? The question is no, we don't have to wait. It is now time that MOH, the National Public Health Institute of Liberia, LIS, and the Joint Security, it is now time that everybody coordinate, not just coming up with press statements, but it is now time that we effectively engage our borders. Other people entering or exiting our country by flight, by road, or whatever means, we should do it. There are people like other countries. What they are doing now is that if you enter the country, they're going to keep you somewhere for out of 48 hours or 72 hours to actually check you before releasing you to the public. I mean, that's the practice right now that should start immediately at RIA, at Botswana, at Guinea, Liberia border, in Gantas, Yekipa, Ivorian border with Liberia. I mean, we need to start that immediately. We should not wait for this virus to enter our country before fighting. It is not possible. We don't have that money in the first place to fight. Or we will wait when people are infected, people are dying, before we wait for WHO, before we wait for partners to come and give us money and then start fighting. So the best way to do none as a government, as our authority, is to start right now, not just publications in the newspaper, press release, and press conferences and stuff like that. It actually needs very active role of those joint security, the National Public Health Institute, the MOH. It needs active role. We need to be very, very active, proactive right now. We should not wait for the virus to enter our territory before starting awareness from village to village. We must start right now. The virus entered the Great America. They didn't know it was coming. Yeah, it entered. And now you have suspected case or cases in the Ivory Coast. Ivory Coast is not far from Liberia. So it's a possibility that the virus if it can enter all countries, there is a huge possibility that it enters Liberia. So to totally avoid this, there should be a very robust measure right now instituted at those various entry and exit point of our country. There is nothing unserious about this virus. Like in Wuhan is already locked down. That's the best way the government feel like yes they can battle this crisis in Wuhan, the host spot of this entire outbreak. In other cities, they are also shutting down the road. People are not traveling or public transport and stuff like that. People are indoor because what? They want to see that this virus end. You have over 100 deaths already from the virus. And you have over total maybe over 600 people already infected, including suspected cases. So that's actually a huge number. And we already know what happened to us during the Ebola virus. We, in the region of Africa or in West Africa, Liberia recorded the highest death as a result of the EVD. So we cannot sit to allow EVD enter our country before fighting, or not EVD but COV. So in order to keep our territory safe, let us make sure those people responsible, agencies, ministries responsible to protect our country should stand up right now to do that. Let's start. Let's work. Let's get to work. It is not very important to get to work. It is very, very important right now to get to work. Let us not wait. We already know what the virus did to our country, both the economy. Then we have already a broken economy. Things are very tough and stuff like that. And then we allow the virus to enter. It is crippled already, and I don't know what's going to happen next when this happens. So to avoid this, it is everyone's business. Both government and the citizen should stand all right now to make sure that we prevent this stuff from entering our country. It is very deadly. Our people back home live in a state of denial. And that was the result. The result of denial caused the many deaths in 2014. Because citizens do not actually trust the system. They feel that, oh yes, the virus is coming, the people want to create things to eat money, and that's the distrust our people have. So the earlier we start informing our people about this virus, the better our chance of having a very safe environment. On anything on the contrary, with this 2019 novel coronavirus being an airborne, it is going to be very terrible for us. So it is very, 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 very important that we start to do something. So let's look at some of the symptoms of the virus. Like we already said, because respiratory viruses, the only means you're going to get this is either the person cough or the person sneezes, the infected person coughs and sneezes, and you are around and you got in contact with the person, or you also got in contact with something that has already been contaminated. So there can be fever and respiratory symptoms such as coughing. These are symptoms that comes with this 2019 novel coronavirus. Either the person coughing, shortness of breath, but then in more severe cases, there has been pneumonia, uh, kidney failure, and the certain death. So once it gets into that stage, I mean, death, like Ebola. Ebola have 21 day or 21 day incubation period. That was so deadly. But for this virus, it is just even still new. I mean, new. We just don't know like how long does it take for you to be infected, how many days it's going to take. I mean, to get to those vital organs and then finally get you, I mean, giving a ghost. We all don't know yet. Studies are still going on. But in the meantime, it is now time that we be we be very proactive as a people, as a country, as a government. We need to be very careful and start strengthening things right now. It will just take little money to prevent this case, but it will take more money and more lives to fight when it enter our country. So let's kindly try our best. Let's try our best to get this virus going away. Like globally, it is being fought. The Chinese are fighting. The Chinese are doing everything possible to make sure that the virus is eradicated. We don't have it now, but yes, we can also prevent it from entering our territory. So, some of those preventive measures that we can use to prevent the virus or to stop us from catching the virus. What are some of those things we need to do? And almost the similar thing like the similar thing like the Ebola virus, those hygienic practices, those basic practices we were doing during the Ebola. That's the same thing we need to do, but we need to reinforce it right now. We need to stand out stronger than before to get our chlorine ready everywhere at all times, to get our hand sanitizer everywhere at all times. And even in some cases, since this is an airborne, it is also important that we also have our masks. We also wear masks. The surgical mask is something that has already been recommended that you can wear. So it is even more important right now that our health practitioner, our brothers, sisters, mothers, fathers in the clinic or wherever health facility, it is now time that we be well attired before administering any help or providing any care to patients. It is now time that you stand up to fight for your life. So it is now time that PPE comes into effect. So wherever PPE are right now, it is now time that we start using it. You don't just touch patient that you don't know anything about. It is now time that you be very protected before looking up to patient. We don't know what happened within a split of second or whatever time. So you don't know exactly what's going on, who is this person, and even your family member showing signs of the virus, like the shortness of breath, coughing, and showing different signs. Encourage the person to quickly visit the health facility. The sad thing about this virus, like the Ebola, it actually has no cure, but intensive care can help. So what been happening? There have been some good stories. There have been some success story behind what going on in China. There have been some people who already recovered from this virus. There actually no specific treatment, but an intensive care being given to those people that are already survived. So those survivors, survive as a result of an intensive care. So being sick and visiting the hospital on time also can save you very, very well. Instead of you waiting to be done, you can't work, you can't do this before going to the health facility, it is wrong. So the earlier you report to the health facility, the better chance you have to survive. So let's try our best, our possible best as people and country and government to make sure that this virus does not enter our territory. So we should be able to clean our hands like the same way we used to do. We should wash our hands with soap and everything. And we make sure we wash our hands. Whatever we do, make sure we wash our hands before even touching our mouth, before touching our eyes, our nose, or whatever body parts. We should be able to wash our hands. We should wash our hands after sneezing. We should wash our hands after coughing. We should also wash our hands, sanitize our hands after caring for sick people. And when caring for sick people to our health practitioner, try your best to be properly attired. That's the best thing you can do. Try your best to be properly attired. So when your hands are dirty, make sure you wash your hands before handling anything. And we should also be careful with how we cook the seafood. Eating uncooked food, animals or seafood, like even eggs. Eating uncooked egg, pork, or any food, it causes a problem. Because we already know most of these viruses, their reservoir has been animal. So eating uncooked animal or whatever, it causes or a problem. It even make us more vulnerable to catching those viruses or being infected. So it is very, very important that we do that. We should be able to cover our nose with the mask, the surgical mask, or there's another mask that is the N95 mask. You can also use that, like the surgical mask. Um, so you have the surgical mask you need to also use. Okay, so this the surgical mask that you need to use. So let's try our possible best to avoid this thing, my people. It is very important. Let's try and do it. We can't fight it. We don't have system to fight. So the best way you can fight, the best way you can do is to run away. Because if you stand, you will be beaten. So since we cannot fight, we don't have the power, we don't have the capacity, we don't have anything to fight. And even if we stand to fight and we don't have the money, after we are beaten, we don't have the money to take care of ourselves. So it is more troubling. So let's try. So quickly, the symptoms for the virus include, like we say, runny nose, like sore throat, headache, fever, coughing, and feeling unwell. So these are just basic symptoms about the virus. So how is it transmitted? Like we said, there are actually no specific, or they are not come up with any more transmission to know that. This thing that transmitted it from this stuff to. Through this means it is transmitted, but because it is respiratory, we only. A scientist or health practitioner only came up with, yes, since it's respiratory virus or disease, yes, it is spread or it is transmitted through coughing and sneezing and then touching contaminated thing. So we should stop those close personal contact, such as handshaking and the basic thing we used to do before Ebola. And then when Ebola came, those things that we were not supposed to do that are recommended by WHO, these are same thing we should be doing right now. So it is very, 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 very important that we stand up as a people to avoid this virus. Let's try our best as a country. This is not plenty time for politics. Everything in the country is politics. And everyone in the country wants to become politician, or they are politician. But when it comes to this particular thing, there is no politics about it. The only thing about it is to fight for our lives. So we should be putting everything aside right now to focus on how we can prevent this virus. So should you have any questions or whatever means, you can either drop it in my inbox. You need some flyers, some basic flyers, or some tips for awareness and stuff like that. You can just ask, just drop in my inbox, and yes, I'll make that available to you. So it is now time that wherever you are in your community, in your village, where you can reach, tell our people to know exactly what's going on about this virus. They should be able to prevent it. They should be able to start taking care of themselves, how they prepare their food, how they welcome strangers, especially people to our borderlands. We already know that you can't depend on government to do anything. Don't wait for government to do anything. If you keep waiting for government, you might even die while waiting for government. Government is not going to do anything. Only us can do something for ourselves. So it is now time that we do something for ourselves. Let's care about our life, the life of our dear family, and our country. Let's try our possible best to do this. Like in Tapeta during the Ebola stuff, we I believe one of the reasons why Tapeta as a referral hospital, and then Tapeta City too, almost close to those rural countries like Lofa and stuff like that, did not experience or did not come in contact with the virus. It was because of the robust awareness, that intensive campaign by the young people of Tabata at that time. I think that was the reason why, even in the presence of an emergency care unit, ETU, emergency treatment unit, ETU in Tabata, nobody contracted the virus. There was no Ebola patient treated in Tapeta. I think the education aspect is very important. Awareness is very important. So that's what we can do for our country. We should be asking what we can do for our country and not what our country can do for us. So in time like this, it is now time that we be asking what we can do to save our lives and that of our compatriots. So let's get to work. Everybody be careful. And I want to say thank you very, very much for, you can leave your questions and yeah, whatever questions you have. Maybe I can acknowledge few of your comments. I can acknowledge few of your comments and okay. This is from Cordy Vayama. He said yes. Yeah, it is important, bro. Yeah, thanks for joining us on the live. And this is from Emmanuel Bayoga Green. He said this is a global crisis. Liberia needs to put in place the necessary precautionary measures now that we still have time. Yes, we have time. So yes, Emmanuel, that's the best thing we can do. We have time. So once time is in our favor, we should do everything possible right now to to fight, to prevent. And Darius also said our country needs to implement quick preventive measures at our various point of entries. Yeah, so that's right, Darius. Our government need to do that, and our people also to those various point of entries also need to be careful on who they receive and basic things like that. So Darius, thank you very much for your input. Oh, but who calls in noise? Yes, the door was open, and that's why Emmanuel. And Nancy King tells more. It is important. Yeah, thank you for joining us too. You all thanks for watching. And Nathan Bala said we need to put in measures to test people coming into our country from China to help reduce the risks of the COVID entering our country. And not only China, there are other countries too, and you don't know who even change flight from this other point to this point. So it is not. All right, so sorry for that. A short break. I felt the person was actually calling. Yeah, so yeah, I think we have little time. If you can call in, yes, I will enable the call button. If you can call and maybe have your say and question or whatever you can suggest to, that's going to be important. And Agustin Thomas, I'm following. Thank you for following. And thanks to our followers from Liberia and also Asia and other parts. Thanks for following. So with this, I want to say thank you very much. I'm going to save the video, and you can share the video and let let us start the awareness. Let's start talking about this. Hopefully, with new tips coming up, new findings, or whatever coming up, I will also be live in subsequent time. I will announce when I will be live to talk about this, and let's try our best to support the process. Let's try our possible best to get this done. So I want to say thank you, thank you very much for joining us on the live video today. Thank you and have a wonderful, 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 wonderful day. Bye.